If you inject diabetes medication, here's everything you need to know about injection technique for better diabetes management. The following guidelines are taken from the best available scientific and clinical studies. If you want your insulin to work properly, always inject into subcutaneous fat, the healthy fatty layer under your skin. Never inject directly into muscle or areas of lipohypertrophy, also known as lipos. 4mm needles are recommended for all adults and children, regardless of age, gender, ethnicity, or body fat level. On average, skin thickness is only about 1.9 to 2.4 millimeters. Therefore, 4mm needles are long enough to reach the fatty layer under the skin, but short enough to ensure that it doesn't reach the muscle. 5 and 6mm needles are also safe and effective, and may be preferred depending on the individual. But if you're using 8mm needles or bigger, this is no longer best practice, as it increases the risk of intramuscular injection, which can lead to dangerous hypos. Needles should be inserted at 90 degrees. You don't need to pinch a skin fold, and you don't need to go in on a 45-degree angle. Site rotation is critical to avoid lipos. Space your injections approximately 1 to 2 centimeters or a finger width apart, and use a new site for every single injection. For example, choose an area, the abdomen, the thigh, the buttock, or the upper arm. Divide that area into 4 quadrants. Select a site within a quadrant to start injecting, and inject 1 finger width away from your last injection. And make sure you use 1 quadrant per week. Use a new needle with every injection. Needle reuse can cause the needle to go blunt and removes the silicone layer, which can lead to unnecessary pain, bleeding, and bruising. Do not inject into lipos. If you inject into the thick, lumpy, bumpy areas under your skin, the insulin will not work properly and can cause unpredictable changes in blood glucose levels. Always remove the needle after use. Don't leave it attached to your insulin pen, as this can cause air bubbles to enter the pen, which can affect the flow of insulin. So remember, select a needle size that's right for you out of 4, 5, or 6mm needles. Use a new needle for every single injection. Inject into the subcutaneous fat at 90 degrees and rotate your injection sites regularly. Drew's Daily Dose pen needles are available on the NDSS in all sizes and gauges. Ask your pharmacist, or you can go get them sent straight to your door for free along with all of your diabetes supplies, thanks to Stripped Supply. I hope these tips help you to better manage your diabetes.